Hi, I'm Karen. I'm the Assistant Administrator here, and I am here to do an update with you about what's going on at Friendship Manor with the COVID-19 protocols. So first of all, why is it Karen talking to you and it's not Ted? You're used to Ted, right? Ted has been exposed to someone who tested positive, and out of an abundance of caution, he is isolating for now, and he's following all of our protocols, and he will return when we know that it's safe for him to return. So we just wanted you to know that. Secondly, I want to update you on our testing situation. We have sent you some explanations about a couple of positives that we had, and that's a story that's interesting to try to untangle. And so I thought I wanted to say it to you in person. So we had one resident who went to the hospital, and while they were at the hospital, they had two COVID tests, one when they got there and one a couple of days later, and they were both negative tests. And then they came back to Silver Cross, and we have a protocol that we test on or around day 5 after return from the hospital. So when we did that test, it was positive, which surprised us because they had no symptoms. And so what we elected to do was test again the next day, and that test was negative, and then we tested again after that. Also, that test was negative. And in the meantime, because we are all about abundance of caution here at Friendship Manor, we tested everyone on that wing just to make sure, because we have staff serving people. And everyone came back negative except one person who was also completely asymptomatic. And so since we'd already had what appeared to be a false positive, we decided, since this was the same lab, we should think about retesting this person too. So we retested this person twice on the same day using 2 different labs. And both of those results are back, and they are both negative. So we are just pleasantly delighted that it appears that we were correct in our assumption that these are false positives. So we have done all the appropriate reporting for these tests, and we want you to know that the state of Illinois, it appears that they will report any positive as positive, false or not, and so the website may show those 2 positives. So we want you to know the story behind those 2 positives. We also want you to know that this week was another round of Silver Cross facility testing. That's just part of the process that we're required to do. And we tested all residents, and we tested all Silver Cross related staff. And we don't have all the results back yet, but what's back is all negative. So we're very excited about that. And we will keep you updated as we go on how that went. Now, we're going to move on to visitation policies. We are excited that things are starting to open up just a little bit. I'm sure that you heard the great delight of staff and residents everywhere that Silver Cross residents now can have outdoor visitors, up to 2. We've got some rules around that, but they can, and that's just exciting. And our residents who were able to get 1 visitor for outdoor visits, right now, as of July 1st, they'll be able to start having 2 visitors. So we came up with a table, a matrix, about the various policies around visitation and safety here, and I'm just going to talk it through with you. So first of all, we're going to talk about COVID universal precautions. Those apply to every human being within our walls. Everyone. And these are social distancing. We need to try to keep 6 feet between each other. We don't intuitively do that as a distance of a full-size couch between us. You have to pay attention to do it. We need to wear a mask when we're out of our apartments or offices or rooms. And we need to wash our hands 20 seconds and hand sanitize in between when we can. Can I talk a minute about masks? Your mask, if it's down here, is effectively not a mask. That's effectively not a mask when it's not over your nose, okay? Your mask when it's down here, it's not a mask. So we need you to wear your mask as a mask should be worn over your nose and over your mouth at all times. And I know that you want to take it off. It's hard to talk, so you want to take it off to talk. While you're talking is when you need the mask on the most. So we just have to muddle through this. So those are our COVID universal precautions. and they apply to everybody. And I want to talk to you about the way we think about masks, because there are some people who are resistant to wearing masks. And what I'm hearing is that there's a feeling among those people that it's a sign of weakness or fear or paranoia. And, they're like, I'm not afraid of germs. I'm not filled with fear. But I would suggest a different approach for thinking about that. Because while your mask does protect you, it's better than nothing, okay? For instance, say I'm standing in my kitchen in my birthday suit. I ran in to get something, and somebody comes into my apartment without knocking, and they've got hot coffee in their hand. If they drop the hot coffee, if I'm in my birthday suit, what will be the result? If I have clothes on, what will be the result? One is a little more protected than the other, right? Same with a mask. More importantly, the mask protects people around you. That's where the real power of the mask is, because we are contagious if we are carrying COVID, mostly through droplets that come out of our mouths while we talk. And so what the mask does is block those droplets. It catches the droplets so that they can't go out and infect other people. So your mask is not a sign that you are afraid. Your mask is a sign that you care about other people, that you care about their health and well-being, and that you're willing to make that sacrifice of the discomfort, and they're uncomfortable. But you care so much about other people that you're willing to do that. So please see your mask as a sign of caring and consideration, and not a sign of fear. That's what masks are really about. Secondly, I want to talk about visitation. All residents all across campus are permitted to have window visits with the window open and both parties wearing masks and maintaining social distance. That is permitted all across the campus. Our independent living residents, including Friendship Place Villa residents, and also our assisted living residents, have for a while now been able to have unsupervised outdoor visits. And we do ask that everyone wear masks, that they maintain their 6 feet of social distance, and that they exercise their hand washing while they're doing that. So that is still permitted. Effective July 1st, we are also adding supervised visits for assisted living. Now you may ask, if I get an unsupervised visit, why do I want a supervised visit? Here's why: because these are being held on the patio outside the bistro. So you'll have the comfort of a table and some chairs. You'll have an umbrella to keep the sun off you. Doesn't that sound nice? And we will have volunteers staffed to fully sanitize the area between visits for your safety and the safety of the visitors before and after yours and yourself. So see Nancy Mann if you want to schedule that. That's a better deal than it sounds like on first blush, those supervised visits. Additionally, of course, as I mentioned, our nursing center people can now have outdoor visitors. That's scheduled through Lisa Terry, and there are protocols around that she can talk you through. And our memory care residents are able to receive visitors as well outdoors, entering through the exterior gate, and the protocols for that can be talked through with Kara Kraft in memory care. She can schedule it and give you all the rules, but their basic rules are mask, social distance, follow the rules. Furthermore, the thing that is very exciting for our independent living residents is effective July 1st, they will be able to leave the campus and not need to give a reason first. So you'll be able to go out as you see fit. And then we ask that when you return, you're going to report in at the concierge desk either that day or call the next day and just say where you went. And we're doing that not because we're your mom and dad, but because we need the record for contact tracing so that if we would have an outbreak, we know where to find out where you were and where we need to check into for further results. We do ask that while you're going out, that you rigorously observe the wearing of the masks, the social distancing, and the hand washing. Just because things are opened up more does not mean you are any less vulnerable to this virus. It is just so dangerous to this population. We do ask that while you're out that you don't go anywhere that has more than 50 people. Also, don't imagine that 48 people is really a bunch safer than 52, okay? We are aware that you are adults. and that you get to make your own decisions. So if you are choosing to go somewhere that has more than 50 people, please make sure that other people around you are also wearing masks. You understand why now, because we talked about how my mask protects you. Please make sure the social distancing is being rigorously observed. And think too about this. Singing, shouting, or talking loud projects those droplets further and adds more danger. So think about where you're going, and if people are singing, shouting, or talking loudly, do they have a mask on? Please don't be there if they don't. For your safety and for the safety of others. Finally, we are hearing from residents that we have some residents here who are feeling like the danger has passed, maybe, I don't know, and are choosing when they are in their own hallways to not wear masks and to not social distance. And what I want you to know is that's already causing angst among your fellow residents because they're worried that they're going to pick something up from you. So if you feel like you're, making a statement or you're being free, you're frightening your fellow residents is what you're doing. And based on what we talked about with masks, you're not protecting their health. So it's always been true during this pandemic that you need to wear your mask and observe your social distance. But as people are going out into the world and are potentially exposed to more things, then the danger is increased. Okay? So you please make the statement, I care about your health. I'm wearing my mask. I'm wearing it properly. If I'm outside my apartment, I'm wearing it. Please be accountable. And let's just generally think as a community. You do not have to go out just because you can. You don't have to. I am allowed to go out. I come and go to work, but you know what? I don't go to stores. I have things delivered. I order ahead and pick things up in the parking lot. When I visit my grandkids, I wear a mask and a shield, and I change clothes before I see them. So we don't have to take all the liberties that we have. We can watch out for each other as a community. And we really want you to know that we're hearing in the local news and in the national news that there is a surge perhaps coming. Maybe you saw the local news story this week that anticipated a surge for our local healthcare providers. We saw it and we are very concerned. Maybe you saw in the national news that 7 states are topping out on their records. We saw that and we are concerned. And so we are watching what's happening. So while we have this July 1 date for release, things could change depending on what happens with that surge. So keep that in mind and know that what we sincerely want more than anything is to give you the most amount of freedom you can have. And so that will be our aim, to keep you safe and give you all the freedom that we can while we do that. The decisions that every one of us make will affect how that goes. So please make your decisions in keeping in mind the community around you, and please be patient as we navigate what that's going to look like in the coming days. Also, while you're going out on these initial visits, I know you'll have young people that you have been missing terribly. The current news shows us that that surge is largely showing up in those younger people in their 30s. Some of them, anecdotally, are partying without protocols. Maybe we'd have done the same when we were that age. Some of them were forced back to work because with reopening, they're not allowed to stay on unemployment if their job will let them come back. Either way, there is a surge happening in that age demographic. So if you go to a gathering and you're so happy to see that person in that age demographic, maybe think twice about the hugs, keep your mask on, please. Keep your social distance. They don't have to be hateful to accidentally expose you. And they're young. Remember how invincible we were when we were that age? So please just keep that in mind while you're going out. And it just takes one careless person to bring the virus here. And the reality is, if we bring the virus here, then the rules are all going to change for pretty much everybody. So let's be really careful. We want this to be wildly successful. We want to keep on celebrating no COVID here, and we want you to have all the freedom that we can reasonably give you. So please keep all that in mind. Please keep all that in your prayers. If you're a praying person, please keep it in your prayers. That's our hope, right? If you have questions, you know where my office is. Give me a call, talk to any staff, and we just appreciate you so much. You have a blessed day, and I'll see you in the hall. Thanks.